So what about RSV? Okay, let's move on to that one a little bit, because RSV is one of the vaccines that they use in babies. Now this is like immune globulin, which is exactly what this is. Okay, when we talked about tetanus immune globulin and hepatitis B immune globulin, this is like the antibody to RSV that they're going to give. So RSV is a respiratory virus, occurs most oftenly in the winter. A lot of hospitalizations, very few deaths. In fact, at that CDC conference I went to in March, they said we're never going to be able to get a vaccine passed for RSV because the death rate is too low. The only way we're going to be able to get them to approve one is looking at the dollars cost per hospitalization. That's how they're going to try to get an RSV vaccine approved. Okay? So what this does, it's made by DNA technology. It's worked in laboratory experiments. And the safety and efficacy for using it for the treatment of the disease has not been established, and it's my understanding that it's used to treat the disease a lot. It's really supposed to be just a prophylactic. And we don't really know about carcinogenesis, mutagenesis, or reproductive toxicities because none of those have been performed, but we give these to little bitty babies. And the most commonly observed adverse reaction is upper respiratory infection, fever, rash, and otitis media. Wow. As an aside, one other little note about otitis media. There are at least 6 vaccines that cause ear infections. And those are listed right off the package insert. Rubella, mumps, hepatitis B, DPT, Hib, MMR, Varivax, and RSV. Let's now think about this for a minute. Kids get vaccines at 2, 4, and 6 months. When do they start getting ear infections? About 8 or 9, 10 months. Then what happens? They get a bunch of antibiotics to suppress their immune system and disrupt their intestinal lining. And then what happens at a year? MMR and chickenpox. So now, think about all that immune system disruption that's happened before MMR and chickenpox ever came along. So a lot of these ear infections that kids are getting, where are the ear infections coming from? Quite possibly the side effects of their vaccines.